nurses, also social workers, who had been working on equity in the workplace or were inspired to work on equity in the workplace because of their own experiences or experiences of their teammates.
Welcome to Sharp Conversations. We are talking about the stories and lives associated with physicians and physician mental well-being. I'm really excited to sit down with you today and hear about your work and your stories and get to know you better.
I am glad to introduce myself, and thank you so much for the invitation to join you in conversation today. It's great to see you both. My name is Resa Lewiss, and I have a knack for making fun of the formal, so I often say my name is Resa E. Lewis. 2 S's, because my last name is spelled with 2 S's rather than 1. And my whole life, I've sort of made sure people are like, is that supposed to be 2 S's? Yes, it is. It's supposed to be 2 S's. So I'm Resa E. Lewis with 2 S's, and I'm a professor of emergency medicine with a secondary appointment in radiology at Thomas Jefferson in Philadelphia, Pennsylvania.
Well, so I'm Subha Airan-Javia. I'm co-host with Janae. Very excited to be here with you, Resa, and to talk to you about things that you've experienced and things that you've seen at work well and maybe have not, and excited for the conversation.
So I want to hear how you became a professor, what your interest is in burnout, everything about your life in 2 seconds or so.
Okay. I grew up in a family with very traditional gender values. So my being a physician was not on the radar according to their plan, but it was pretty much always on the radar according to my plan. And I went to college at Brown University, and I was pre-med as well. I concentrated in sociology, racial ethnic studies. I attended med school in Philadelphia at the University of Pennsylvania, and I was just amazed. When I was there, there were a lot of children of physicians there, and they were like, well, of course I'm here. Where I was like, I cannot believe I'm here. I cannot believe I'm here. And I just was amazed, and I've always considered it a privilege and a lifetime commitment to be a physician, to be a clinician, to take care of patients. And I never have taken the responsibility lightly. I've kind of always been one of those responsible good kids. I was not sure what I wanted to be in terms of specialty, and I thought I was going to be a surgeon, and I liked it, but I didn't love it enough. I did a year of research at the NIH, came back, and to get my feet wet, I did an emergency medicine rotation, and I was like, where have I been? This is it. This is right for me. So I pursued specialty training in emergency medicine in Boston, and it was a Harvard-affiliated program. And when I finished training, all those years of training, I'd pretty much been a bit brainwashed academic, and I thought, do I really want to do this? Do I really want this? And I spent a year in the community to buff up my clinical skills, just doing patient care. And I thought, I think academics is right. So the opportunity came up to do a fellowship in ultrasound. This was in 2002. So I completed an ultrasound fellowship, and it was one of the only fellowships in the country at the time. And one of my mentors, who to this day is one of my dear friends, said, Resa Lewiss, ultrasound is never going to go anywhere. It never has gone anywhere. And then all of a sudden, ultrasound and the use for patient care diagnostically and safe procedures completely took off. So most of my professional career has been publishing, speaking, leading, building programs in point-of-care ultrasound. That being said, along the way, I definitely noticed health disparities, both on the patient side as well as the training and clinician side. I was acutely aware that emergency medicine, the shift work, the nights, the weekends, the holidays, the sine wave of stress, not stress, stress, not stress, stress, not stress, can do something to you in terms of your life, your health, your sleep. And you're probably familiar with the data. Some of the highest rates of burnout, some of the highest rates of dying by suicide, some of the highest rates of alcohol and other drug dependence are in the specialty of emergency medicine. And this, preceded COVID. So this is sort of a thing. And when I've had non-medical friends say to me, Resa, I read in Time magazine, or I read in, US World News Report that like there's really high rates in your specialty. And I was like, yeah, you should be worried about me. You should be worried about me. And that being said, in all seriousness, I've always tried to take very good care of myself for some of those reasons and more.
I have a question. Why do you think that is? Like you said, culturally, there's a lot emergency medicine education. Is that what you said?
It's just the lifestyle of emergency medicine clinicians, as well as, like most specialties in medicine, hierarchical, male leadership, shift work in terms of nights, weekends, holidays, and constantly being exposed to traumatic scenarios, stressful scenarios. There was always this, I think, thought that as an emergency doctor, you don't, quote, take care and worry about your patients. But, I care a lot about my patients. I take a lot, and I think about my patients post-shift. I remember when I was in residency training, I was on an off-service rotation. I was in the cardiac step-down unit, and I was on an overnight shift. And someone said to me, Resa, you really care about your patients. Do you ever think about switching to internal medicine? And it was one of those, like, compliment, not compliment, compliment, not compliment.
That's hilarious.
But, yeah.
As the internal medicine doc in the room, I feel it. So, Resa, I think it's really interesting hearing about that experience, because one thing that is really interesting to me is that depending on where you train, whether it's school or residency, experiences can be so different. I actually just came back from the Women in Medicine conference in Chicago, which was phenomenal. And hearing about some of these statistics, and I know you're one of the founders of Time's Up Healthcare, which is something I'd love to hear more about, both in terms of what drove you to do it and, what your experience has been and how that, how it's impacted your own, well-being. But I guess I'm just reflecting that people have been through a lot of horrible experiences. The statistics are awful when it comes to, looking at promotion and advancement and pay. And I feel like I've been, I guess, a little bit insulated from that, at least in my personal experience at Penn, which has been very positive. There's certainly been things that could have been better, which there is everywhere. And I guess I try not to think about them as much. But it can be so variable depending on where you are, which I guess is somewhat dependent on the leadership there. But
I think it's also, you both went to fancy schools. Like you both went to Ivy League schools. I don't know if I'm allowed to call that out. I feel like there are a couple things that are interesting, like the gender levels, but also like you mentioned, a lot of kids who come from medicine go into medicine.
Yeah.
And we're doing work too, trying to recruit physicians who are Black, recruit physicians who you wouldn't normally see in medicine. And it's very different.
Well, just that, Brown undergraduate is a little different than the experience of Brown Medical. So it was my undergraduate experience at Brown University, and it's 100% true. In general, undergraduates love that school. And then if they don't love it, they transfer out. So people feel very strongly about it. And I still, to this day, think it's an amazing experience and am very involved as an alum. In fact, I serve on the Women's Leadership Council for Brown University, which is a very inspiring, amazing group of Brown women alum, and who are looking to give back, who are looking to contribute, and share their experiences for students who are there now, as well as to give back to the university.
Resa, can you tell us a little bit about what your journey to co-found Time's Up Healthcare and how that's been?
Yeah. So I think, first of all, I have been witness to the inequities in medicine. And again, I did make a distinction. There's healthcare disparities and inequities on the patient side. And then it's not obviously this and this, but, what I speak on when I talk about equity in the healthcare workplace and Time's Up Healthcare as an example, we're talking a little bit on the clinician, trainer, worker side. And citing some of the statistics that Subha, you noted, like, 11% of chairs of academic emergency medicine departments are women. And so I've always been aware of sort of inequities in terms of being a woman in medicine. And I've always been aware that if you have compounding, that there's a compounding effect if you have other identities like underrepresented in medicine and woman, like the marginalized groups have a compounding effect of some of these experiences of harassment, salary disparities, other inequities. And, since college, I've been either direct or indirect witness to events, to instances in med school, then residency training, and then as an early career physician, and certainly as a mid-career physician. And in fact, inspired by the launch in 2019 of Time's Up Healthcare, a group of authors wrote a piece about, is academic medicine making mid-career women invisible? Because what I had noticed, not alone just me, I was having conversations with lots of women friends in medicine, men friends as well, that women were kind of disappearing. Either they were taking themselves out of medicine or medicine was somehow eliminating them. Now that sounds sort of extreme, but what I'm saying is they either were opting to do alternative or complementary careers in healthcare. Like as I saw my men friends ascending and sort of getting promoted from instructor to assistant to associate to full professor, women were dropping out. They were either, like I said, going part-time, or they were starting other businesses, or they were no longer academic. They were going to work in the community. And, the reasoning was always sort of their choice, or home duties, or children, or elderly parents, or, women aren't that ambitious, or women aren't innately leaders. Things that we know aren't true. They really aren't true. So within emergency medicine, this group formed called FAMIA, Women in Emergency Medicine. And I started attending conferences and seeing the movement and seeing how powerful it was and empowering for women, just to see other role models, just to help women navigate the clinical and work environment. Like if they wanted to be academic, what do you need to do? How do you get published? How do you be invited to speak? How do you lead national organizations? These things that, quite honestly, I learned from men. Men taught me, men mentors, men allies. Not that there are a lot of them, but the ones that I had, they kind of taught me the tricks of the trade. And I just wish, I wish there were a playbook that I was handed at the beginning of this whole pre-med to med experience, that people seem to have gotten the playbook or the 411, the information that I didn't get.
I need that playbook, please.
Yeah. And then so from Feminine, some of the same women in emergency medicine that were organizing founders of Feminine became involved with Time's Up. And they started working with Time's Up national leadership to form Time's Up Healthcare. So I was invited to be a founding member. There were 50 of us to be a founding member of Time's Up Healthcare. And what I can say about that experience was I met other like-minded, inspiring, intelligent, competent women from all different specialties, not just physicians, also nurses, also social workers, who had been working on equity in the workplace, or were inspired to work on equity in the workplace because of their own experiences or experiences of their teammates.
And how has it changed or morphed, or what is the work that's happening with Time's Up Healthcare now amidst COVID?
But many of us remain in touch, and I think are forever connected because of our experience as founders. And, going back to this piece that we published about invisibility in mid-career women, for me, it's been an amazing opportunity for friendships, for ongoing connections, and for academic productivity.
It's interesting. We talk a lot about how community and those connections help with burnout, right? They help with mental illness in general, and feeling lonely. And so it sounds like the community itself has been very helpful for everybody involved.
I have a podcast called The Visible Voices, and we cover topics of healthcare equity and current trends. And I've had quite a few guests come on to talk about this in healthcare. However, for example, Cindy Gallup talks about it in advertising, or other colleagues have talked about it in their industries. What I've learned is if you're having the experience, you're not the only one. If your industry is having the experience, you're not the only industry. And I think the world thinks healthcare and doctors are somehow immune, somehow different, somehow better. And it's not. It's actually, pretty concerning and surprising when people see those numbers, like the 11% of, chairs of academic emergency medicine departments are women, or only 18% of chairs across all specialties, 19% of deans at medical schools. Like, the numbers are not great. Again, talking about women and not ignoring the fact that with people with intersectional identities and memberships, the numbers are even worse, and it's more of a compounding effect.